what would you say for a patient who just recently diagnosed, with primary tumor that is waiting for surgery to start, and not at advanced level, that doesn't need chemotherapy yet,
Yeah.
but still have a surgery that is supposed to happen and remove the tumor?
Right. And so in every place where that's happening, people have to weigh the risks and benefits right where they are. So the fact of the matter is that we know that most of our data shows that it may take as long as 10 years for someone to go from having a polyp to having a cancer. And that if you're put off for a few months, it probably isn't a dramatic change. Now, that's really scary when it's you. And when we're saying, okay, for you, we can, let's wait for a couple months. But it's not as if you go into the hospital right now, there are no risks. Unfortunately, there's some significant risks of being in the hospital. First of all, as opposed to being socially isolated in your home where you only have your immediate family, maybe, whoever delivers stuff, or whether you get to the grocery store, things like that. In the hospital, you're obviously going to be exposed to a lot of different people, both care providers who may also be taking care of COVID positive patients, as well as other patients. If you have a surgery and you're walking in the hallway, you're going to pass by other patients who will also have risk factors and their own families, things like that. There's also some data that's come out and is really concerning out of Italy and out of China, that patients who've had surgery, even if we didn't think they had COVID when they went into surgery, some of those patients end up becoming positive. We don't know if that's because they actually contracted COVID while in the hospital, or if they were positive in kind of what we call the prodromal phase when they were at home, meaning they didn't yet have symptoms. They went to the surgery, they didn't have any symptoms of having COVID, and then only started having symptoms afterwards, even though they were infected before. But the risk of death in those patients, as high as 20 to 30%, if patients turn positive in the postoperative period, which is obviously significant, especially when we're talking about holding off a couple months, they may have a real risk of having complications they wouldn't have had otherwise. The other thing I would say is that even places like Cleveland, where again, we're super fortunate, we're not allowing any visitors in the hospital, which means that in the postoperative period, as opposed to having your family, your loved ones around, to walk with you, to get you better from surgery, you're there with nurses and doctors and, practitioners who really want to take good care of you and help take care of you. But it's not the same as having your loved ones around. So there are some significant risks, even if you decide to have surgery, and even if you are fortunate enough to be in a place like Cleveland where we can do surgery right now.
Great, thank you. That explains a lot. I think you mentioned that was for polyps and primary tumors. What happens in the setting of metastatic cancer? What are the options for patients who have metastatics and waiting for surgery for removing those?
Yeah, well, so one of the good things about colon cancer and treatment for colon cancer is that our chemotherapies aren't quite as immunosuppressive as other chemotherapies. And what that means is that when you have certain kinds of cancer, the chemotherapies that we give you make you very susceptible for different types of infections, such as COVID. With colon cancer, the majority of the patients still have really strong, healthy immune systems, even while they're going through chemotherapy. So when we think about someone who's going to get chemotherapy right now for a colon or rectal cancer, for metastatic disease, the good news is they're not as high risk of having problems from that as other types of cancer, patients with other types of cancer may be. In addition, we're still doing surgery for some people. For instance, if you come in and you have an obstructing colon cancer, we're certainly doing that. In Cleveland, we're still able to do that for people with symptoms. They may be bleeding, they may have a large cancer. And at this time, we're still able to do some surgeries for people where we think that that's the right treatment to do right now. It's just that that balance is a little bit different than it may normally have been. And we're trying as much as possible to give them other therapies. For instance, someone who comes in with rectal cancer might undergo radiation right now, and we may have changed that radiation treatment from a long course where they would get radiation over 6 weeks to a short course, again, to decrease the risk of exposure just to 5 days. And then we might just say, okay, we're going to let that radiation work over the next several months, and we'll bring them back in and do surgery when it's a little bit safer.
Yeah, that's good. Thank you. And The other question I have is, what would you say, how do you address patients? What do you say to them if they are coming as like, they're very anxious about their tumors and they have to delay it? And what are the other services provided maybe for them?
Yeah. So one of the hardest things is that even when we see patients, normally we would see a patient in the office and we'd have a chance to meet face and face. And a lot of our even initial evaluations may be over some sort of, FaceTime, Zoom, something like that, in order to meet our patients now, which is a real big change for us too. We like being there with our patients. We like to be sympathetic and be able to get to see them, their whole family, and get to know them. So it's a little bit of a change for us as well. I think that what we can tell patients is that we are really looking into their best interests. The other thing that's reassuring is that it's not me making these decisions completely on my own. In most cases, what's happening is there's a multidisciplinary tumor board that's making these kinds of decisions, and a similar type of board that decides whether or not you can go for surgery. And what that means in terms of the cancer part is that I sit down with my colleagues who are surgeons, with gastroenterologists, with oncologists, with radiation therapists, with the pathologist, and with the radiologist. And together, we're trying to make the best decisions possible for that patient, as well as for our healthcare system right now.
Thank you. And I also wanted to touch upon about the risk for you and your colleagues as physicians being doing those surgeries. And can you just talk about that?
Well, there's a lot in the news about the personal protective equipment, PPE as it's called colloquially, and doing types of that. We don't really know what those risks are. The concern is that the virus may not just be when you cough or when you sneeze, but there may actually be virus in other body fluids. For instance, we're doing less screening colonoscopies. We're finding less cancer right now, because if somebody just is due for their colonoscopy because they're age 45 or above, we're not necessarily doing a colonoscopy because there's concern that there has been virus found in stool. In order to protect us, the practitioners, we're wearing special masks, and it makes it hard for us to talk. It makes it sometimes uncomfortable for us, both just in talking to people and also while we're doing surgery. But those are protective things to prevent us from inhaling and getting the virus as well. One of the areas that really affects surgery in colon cancer and rectal cancer surgery is that there is also some concern that if we do minimally invasive surgery, where we blow the belly up with air, and this is true for laparoscopic or robotic surgery, that there's some concern, and we don't know if it's really true or not yet, that there may be more virus when we blow the belly up. If you think about a balloon, and you let the air out of a balloon, it comes into your face. And the same thing is a little bit true when we create that space in order to do surgery on a patient, is that for us, the practitioners, myself, the anesthesiologist, the nurses in the rooms, all of those types of people, is there a higher risk that we could get infected? And as we all know, unfortunately, medical providers are in short supply right now and very much needed in order to continue taking care of patients.
So that gets to my other question, is there could be any surgeries that are doing like outpatient instead of in the hospital, but you kind of answered that right now was about the minimal invasive surgeries, right?
Well, so as much as possible, we're trying to do that. We think that there still is some risk for patients to go into the hospital to get put to sleep and things like that. We're still trying to do the right thing, and every person in every local environment is really, taking everything into account. For instance, in New York right now, New York City, you're not going to be getting surgery unless there's something that is really life and death right now. The other thing I want to warn people against is that traveling right now to try to get surgery also isn't a great option. It's one thing if you can go across town. It's another thing to switch cities or switch states, because then you may be changing the local demographics and keeping, when we talk about flattening the curve and staying home, that's the exact opposite of what we need to do. And again, we got to go back to the fact that these tumors in general grow really slowly. And so we each need to do the right thing so that we can protect our entire environment.
Right. Thank you. And then how long do you think we can hold off surgeries and for patients when we're going to started going back to normal, and or at least follow up on somebody who was diagnosed a couple of months ago, and now it's like time to go on.
Yeah, great question. So my magic 8 ball is not working. I'm trying to look into it to see. We're hopeful that in places like Cleveland, where we're either at the peak or hopefully close to the peak, that we'll be able to relax some of our restrictions right now and be able to open things up a little bit more. And what that means is, when we came into this, a few weeks ago, 3-4 weeks ago, not only were we trying not to operate on patients because we didn't want to expose them, but we also were instructed that we needed to keep the hospitals relatively quiet so that there was room in case more COVID patients came in. As things are getting under control, as we flatten that curve, in different areas, we may be able to release some of the restrictions on operating and be able to take some of those patients back in. That may be a time where it's reasonable to talk to your local providers about whether or not if they can't do the surgery there, that you could safely be moved somewhere else to be able to have your surgery. I'm hoping that some of those restrictions, even in the next few weeks, we might see small changes, but probably it's going to take a couple months until we see big changes in big areas of the country changing in terms of what they can do in hospitals.
Right. Thank you. I see that we have several questions. Maybe we should move to questions from the audience.
Dr. Yarden, are you able to see those questions that are coming in?
I actually, yes, I am. I can read them. So we have a question from our patient navigator that has a lot of phone calls from patients who are stressed. That told their surgeries are like reversals are being put off. What can be done for their for the stress and anxiety?
Yeah, really, it's really hard. I think that trying to do whatever you can, and everyone's stress is handled differently. I think getting a little bit of exercise is great if you can, safely go for a walk, doing things like that. Things like meditation and yoga have also been shown to do that. To help. The good news is that in most parts of the country, not necessarily down way south right now, but the weather is getting a little bit better, and people maybe can get outside in appropriate ways and try to do that. One of the things that I get asked all the time by my patients, without COVID as well, is what do I do until my surgery? It might be a week or two until their surgery, and they ask, oh, can I eat certain things? Can I do certain things? I think the most important thing is both mentally and physically to keep yourself as healthy as possible. As long as you're going to the bathroom, okay, you can keep eating and drinking in most cases, what you've normally been eating and drinking, and just trying to take good care of yourself, keep yourself healthy, keep yourself well hydrated, and don't get constipated, for colon cancers. And then also really just try to take care of yourself mentally as much as possible. It's stressful for all of us.
Right. Yes. Thank you. Stephen, there's a lot of questions in the chat that I cannot see right now.
I see one here too that they were asking about things like reversals in terms of having a stoma reverse. And that's something I alluded to before. That's the kind of surgery that right now, even in Cleveland, we're not doing. It's hard to live with an ostomy. It's really can be difficult. And some people have some significant difficulties either staying hydrated, keeping their stoma appliance on, things like that. I think the good news is that you're okay, that the cancer has been taken out in those cases. And in some ways you're real fortunate. And so holding on for a little bit longer until we can safely get you into a hospital, until we feel that we can safely get you through surgery without risking you getting sicker, without increasing your risk of complications, I think that's the best thing possible. And then the other thing too is that most providers still have the ability to reach out over the phone. So talk to your physician, and sometimes that can make you feel better as well.
Thanks a lot. And then for those who do have surgery, I think you kind of alluded that they're going to be by themselves. They don't have family that or caregivers that can, but is there any other way of communication while they're there? Is there telehealth with the caregivers that can comfort the patient?
Yeah, so the caregivers are still going in to see patients. So the caregivers are still around in terms of the hospital caregivers, in terms of your own personal family, things like that, you know, just using your smartphone. I guess the good news about something like this is we've all become a little bit better at using social media, at using Zoom technology, at using Facebook Live, FaceTiming with friends and family. Those types of things are absolutely allowed and absolutely encouraged. It's not that we're trying to keep family and friends away from people who have to have surgery. It's just that we're trying to keep everybody safe. So that's absolutely encouraged. It looks like there's a question about the shorter radiation schedule.
Right.
So as opposed to having 5 days a week for 5 or 6 weeks, a short course radiation therapy, if your doctor feels that's an appropriate way to go, is usually just 1 week of radiation. It's 5 days. And that will obviously keep you out of the hospital. So rather than having to go to the hospital 25 or 30 times, you only have to go for 1 week.
That's good. That's good. Thank you. I don't see any other questions. Is there anything that you want to summarize for our patients to know?
You know, I think one of the things that's real hard for both our patients and also for the providers is that as surgeons, as a doctor, I'm so used to thinking, how can I best take care of this one patient right now, this patient sitting in front of me, and what are the best decisions? And in something like a pandemic where we really have an entire healthcare system that's in crisis, we have to kind of think a little bit bigger. And that's really hard when it's you who's going through that, when it's your loved one who's going through that. But there are not only just risks and benefits for the entire system, there are actually risks and benefits for you. And I think the idea that by keeping people home, even people who we know have colon cancers home, we're keeping them safe is real hard to kind of digest and to understand. But that's really what the providers are trying to do. And that's really what we're thinking about. We're thinking about how do we get all these people through safely in order to get them to the other side of this pandemic.
Thank you. That was very helpful. I think and I think the Facebook, the Zoom, that this session will be posted on our social media, and I think a lot of patients will be able to watch it and get educated about what is happening in the world of surgery, of colorectal cancer surgeries now and during COVID-19. So thank you so much for your time.
Thanks for having me. It's a pleasure. And, you know, just everyone stay home, please, and stay safe.
Everyone stay home and stay safe and flatten the curve. Right. Thank you so much.